Hi, I'm Victoria Loki, the Education and Learning Lead for Family Caregivers of British Columbia. I'll be presenting today on optimizing self-management and family support. Family Caregivers of BC is a nonprofit charity dedicated to the well-being of family caregivers. We are the first of our kind in Canada, and we've been serving caregivers for more than 30 years. Since 2010, the organization has expanded from local to provincial levels, focusing on caregiver needs, resources, and supports in BC as part of the Patients as Partners initiative. We provide caregiver support through information, referral, and navigation. One-to-one caregiver coaching is available after assessment, and we also provide support groups, both virtual and in person, and online resources. Among our education resources online are webinars and workshops. We also have access to articles and podcasts, events, and presentations. The collaboration and engagement that we do involves health system improvement. We participate in research, and we work to inform policy. The learning objectives for today include defining what a family or friend caregiver looks like, looking at the role and scope of caregiving, discussing the daily activities of providing care, common caregiver needs, an introduction to the idea of creating a circle of care, as well as just a review of where you can find Family Caregivers of BC resources. So what's a caregiver? There are many different ways that you can describe a caregiver, but for our purposes, it's a family member or friend who provides care and support to someone living with a disease, disability, or frailty due to age. The role of family caregiver or friend caregiver is mutually determined by the people providing care and the person receiving it. How much time is spent on caregiving? Well, it's a lot. For every hour the healthcare system spends, family or friend caregivers give 10 hours of their time. If you want to look at it in terms of numbers, that's 28% of the population, or over a million, 1.376 million in British Columbia alone. What can the impact be on the health of a family or friend caregiver? Well, there are many. Depression and anxiety, insomnia, hypertension, and back injuries are all commonly reported. Caregivers report chronic health conditions, increased stress, and compromised immune system. So what are the signs of stress in a family or friend caregiver? Often, when they're stressed, it can show up in many ways, including denial. They may deny the depths of their struggles. They may be irritable or easily angered. Caregivers often stop socializing as much when they're stressed. They can experience anxiety and depression as they become more exhausted. COVID has caused many caregivers and their care recipients to become more isolated, which has contributed to an increase in mental health issues. Caregivers may not have appropriate emotional reactions due to their stress, and they may seem glib or lighthearted about their issues. They may be defensive. They may have trouble focusing on tasks at work or activities that require concentration. Caregivers report chronic health issues at twice the rate of the general population. Well, what do caregivers need? It's important as a caregiver to identify what your needs are. Across the board, caregivers have reported that they need support from friends, family, and community. They benefit from respite. They need connection. And they also need to define and have their boundaries honored. A big challenge for caregivers is isolation. It's difficult to maintain connections when you're so busy as a caregiver and so involved in the work you're doing. They are often consumed by all of the tasks they have to juggle, and few are available for family and friends, and neglect their social health as a result. Asking for help is something most caregivers struggle with. Value is placed in our society on being independent, and caregivers often hesitate to ask for help out of feelings that they may be a burden to others. Caregiving is not something that can be done alone in isolation for long periods. It does result in hardship and challenge, as we've mentioned. One of the things I talked about is a circle of care. So what is a circle of care? It's an informal network that a caregiver creates to provide them with support, respite options, brainstorming options, and a sense of community for themselves as caregivers. It helps to create social networks. It helps provide ways of dealing with crises as they come up. It can reduce the demands on the healthcare system, and it addresses the isolation that's experienced by many caregivers. It increases the quality of life for both caregivers and their care recipients as they increase community capacity together for caregivers and their recipients. So how do you build a circle of care? At Family Caregivers of BC, we can help you facilitate the process, but what you'll need to do is identify your needs, determine who you can ask for help, then explore how you can ask for help, and then value that circle of care. What that means is that when friends or other family members offer to support you, ask what they can do, it helps if you've got a plan in place and tasks at the ready that you can provide them so that you can follow up on offers. Be specific. Have a list of things that other people can maybe step in and do. Be direct. Just ask for the help. If you're direct about what you need, people can then respond in a concrete way. Appreciate and validate those who step up to help. Over and over, validation helps folks feel that what they've done makes a difference, and it'll help them want to keep helping you. And then keep asking. So that's how family and friend caregivers can support you. We can help you with building a circle of care. We can also help with support groups for caregivers. We have a number of online resources and supports available on our website at familycaregiversbc.ca. These include access to our caregiver support line at 1-877-520-3267. That support line is operating Monday to Friday. You leave a message and someone will call you back within 1 or 2 business days. We also offer caregiver coaching. We offer information. We have a regular newsletter and e-news, articles and blogs, webinars, audio from our podcast, all available on our website. Please have a look at our site, reach out to our caregiver support line. We're here to help. Thank you.
Hi, everyone. My name is Caitlin Archibald, and I'm a specialist in health policy and engagement with the Heart and Stroke team in Manitoba. I'm delighted to be able to join in virtually today to discuss stroke self-management and support, as well as review the resources that Heart and Stroke offers for those living with and for those caring for someone living with stroke. A really wonderful part of my position with Heart and Stroke is being able to connect with those with lived experience, as well as caregivers of those with lived experience for heart disease and stroke. Heart and Stroke has a variety of informative resources that we'll review together in a moment to help guide people through their rehabilitation and recovery journey. Please feel welcome to take down my contact information. I'm happy to connect after the presentation to answer any questions or direct to the resources and supports that Heart and Stroke has to offer. Heart and Stroke is a leading Canadian health charity for over 70 years. You'll notice our vision is stated as life uninterrupted by heart disease and stroke, while our mission is to promote health, save lives, and enhance recovery. Since our inception in 1952, we have invested over $1.5 billion in research funding nationally as the largest non-government funder of heart disease and stroke research in Canada. Here are just a couple of examples of research breakthroughs that Heart and Stroke has been involved with over the years. We have the first open heart surgery in Canada in 1954, which used a technique developed in partnership with Heart and Stroke. In 1983, we also have Dr. Robert Cote, who developed the Canadian Neurological Scale, which is now used worldwide. And finally, in 2009, the world's first in utero surgery to correct congenital heart defects. All of this information and more can be found under the What We Do tab at heartandstroke.ca. The first go-to for all things Heart and Stroke Foundation is, of course, our webpage, heartandstroke.ca. The Heart and Stroke website is full of many amazing resources and is easy to navigate as well. You'll notice the top navigation bar separates information from heart disease, stroke, healthy living, what we do, and how you can help, depending on what you might be looking for. You'll also notice the main focus of our homepage right now is a new resource called the Beat podcast. The Beat was recently launched for Heart Month in February and focuses on bridging cutting-edge science with the realities of living with heart disease and stroke. You can access this from the Heart and Stroke webpage or from wherever you might get your podcasts. The first area we'll focus on under the Stroke tab is recovery and support. Here you'll find lots of great information from how stroke is treated to life after stroke, which covers information from living with physical changes to changes to emotions, energy and thinking, relationships, returning to work, as well as legal and financial considerations. The first resource under the Recovery and Support tab is our guidebook called Your Stroke Journey. This booklet is available for download from the website, as well as for paper copy order. The book reviews understanding stroke, stroke care, prevention, living with changes, as well as returning to work, and has a variety of tips and strategies for helping to live your life fully after stroke. For anyone who may be wishing to order any of the Heart and Stroke resources in paper copy, we can also use this order sheet to mail out resources on stroke, heart disease, prevention, and health promotion in either English or French. This order page can be found on our website, or again, please feel free to contact me and I can send this out to you as well. Heart and Stroke Canada also manages the Canadian Stroke Best Practice site, where you'll find a number of resources for both patient and caregiver, which we'll go through in a bit more detail here shortly. For example, we have resources available for secondary prevention, your guide to taking charge of your stroke recovery. This one here, again, take action to prevent another stroke, or TIA, with a variety of strategies and tips listed. You'll also find a checklist for self-management following stroke, with sections on safe physical activity, skin health, nutrition, feeding and swallowing, speech, vision, and more. Moving on, there's also a guide for rehabilitation and recovery here. Please feel free to browse the site to review the resources in greater depth. Resources for both patient, caregiver, and healthcare provider can all be found here, including a family guide to pediatric stroke, stroke in young adults, as well as the fast signs of stroke. Aside from our resources on paper, Heart and Stroke also offers online peer support groups called Community of Survivors for those with lived experience, as well as the Care Supporters community for caregivers of those with heart disease or stroke. These private online communities are built to support one another and are moderated by Heart and Stroke on Facebook. For anyone wishing to join, you can apply through our website, through either the Community or Survivors group or the Care Supporters community, and application is fairly quick as well. The Community Connect newsletter is a great way to stay connected with Heart and Stroke resource and events, information on new resources, upcoming research, and more. The newsletter is released monthly and is free to sign up for both survivors of heart disease or stroke, as well as caregivers. The last resource I'll mention is the Heart and Stroke Living with Stroke program. This program was previously being delivered in person across Canada, however, is currently being remodeled for virtual delivery and general updating at the moment. The Living with Stroke program is an 8-week self-management program that focuses on skill development and goal setting to enhance quality of life for those living with heart disease or stroke. Heart and Stroke is looking forward to bringing this program back to the public in the near future to help support stroke recovery. For anyone wishing to learn more about the program, You can register for waitlist online and will be contacted once a session near you is available soon. Please feel welcome to reach out with any questions regarding the presentation materials. Again, I can be reached at CaitlinArchibald@heartandstroke.ca or by phone there at 204-926-3131. I'm happy to send out any of the following links or to just answer any general questions that you might have and how Heart and Stroke might be able to help you. So thank you everyone so much for your time. It was a pleasure presenting to you today. Thank you.